Hi everyone, this is Joel Vergis from B-GHUD Academy, and I'm here with you as a part of our 10 Essential Roleplay series. And today, we'll be presenting an intermediate roleplay with regards to a patient who is suspected to have athlete's foot and the doctor who has suggested them to undergo a diagnostic procedure.
Okay, Anpan, here is a roleplay card. You can start preparing now.
Thank you.
Alright, Anpan, your time's up. You can start now.
Good afternoon.
Hi, good afternoon.
Please make yourself comfortable.
Thank you so much.
My name is Anpan and I'm one of the registered nurses working in this dermatology clinic. And if I'm not wrong, you're Mr. Anthony, right?
Yes, I'm Anthony.
Pleasure to meet you, Mr. Anthony.
Pleasure to meet you as well.
So if I'm not wrong, you already consulted the doctor, right?
Yes.
And you came in with complaints of itchy blisters between the toes and soles, which are stinging and burning.
Yeah.
Isn't it?
Yes.
After the initial diagnosis, the doctor suspects that you have a condition called athlete's foot. Please don't panic when you hear this term. I will explain everything to you in detail. Along with that, I will explain to you regarding the tests that you need to undergo in order to confirm your diagnosis.
Okay.
And also regarding the further management.
Okay, alright.
So first of all, I'll explain to you regarding your condition. Athlete's foot is nothing serious. It's just a contagious fungal infection seen on feet and usually contracted by athletes.
Okay.
There are various causes for this kind of condition. So shall I explain more about that?
Please do.
This condition is usually caused due to direct contact with an infected person or due to contact with an infected surface. And the causative organism for this condition is called Tinea fungus.
Okay.
So if this fungus is present on a surface and you walk on this specific surface, then there is a chance that you might also get this condition.
Okay.
I hope you understand so far, right?
Yes, I did.
There are various risk factors associated with this condition. For example, if a person has the habit of walking barefoot or sharing their shoes or socks with other people, then there's a chance that this person might contract this condition. Because we don't know whether the people we are sharing our shoes or socks with have this kind of condition. So it's better to avoid these habits.
Okay, alright.
Next, I would like to talk to you regarding the test that the doctor advised you to undergo, called KOCH test. This is a short form for potassium hydroxide, which is the name of a solution. During this procedure, the doctor will scrape a small part of the infected area and this will be placed in the KOH solution.
Okay, I understood.
The solution will kill off all the normal skin cells and leave behind only the fungal cells. When these fungal cells are observed under the microscope, we will be able to completely diagnose your condition. So that is why I request you to undergo this test. So are you willing to?
Yes, I'm ready to do that.
Alright, I'm glad to hear that. So after confirmation, the doctor might prescribe you some medications like topical ointments that can be applied over the infected area, like clotrimazole or steroids. And then in addition to that, the doctor might also prescribe you some oral tablets like fluconazole. These medications will definitely help to reduce the painful inflammation. But the doctor can only provide you these medications after properly confirming your diagnosis. So it's essential that you do the test at the earliest. So shall I make the arrangements for the test right now?
Well, do I need to do it right away?
That's a reasonable concern, Mr. Anthony. If you have some prior arrangements, you can avoid undergoing the test right now. But make sure that you undergo the test as soon as possible.
Okay.
Because we can only provide you the necessary management after proper diagnosis. So, is there anything else that I need to clarify?
Well, not really, no.
Alright. I hope I've clarified all your doubts. If you have any other concerns, you can always contact us. Thank you for listening patiently, Mr. Anthony. Have a nice day.
Thank you so much.
Now let us dive into and understand how we could tackle such a scenario. So, on a cursory glance of this roleplay, we can see that the setting is a dermatology clinic and the doctor has already seen the patient. And here, you can see that you have been advised to talk to the patient regarding the skin test and about the further management of the scenario. Okay, so because of these reasons, we can treat this as a known case. And this is because, as you can see in the role play card, we can see that you have been advised to provide information regarding the skin test and the cause of the condition of the patient. So due to these reasons, we'll be handling this case as a known case. So given that the patient is meeting with you after the doctor's consultation, we can start off by confirming the identity of the patient. This is because in the role play card, it has not been specified whether you as the nurse have had a conversation with the patient before this. So when we're starting off, we can greet the patient according to the time during which you're holding the conversation. So now it being the afternoon, we can start off by greeting them as good afternoon. And then you can introduce yourself. My name is Joel Vergis, one of the registered nurses at this dermatology clinic. So after going through your role play card, we can start off by presenting the role play. Then we can confirm the patient by asking, if I'm not wrong, you must be Mr. Anthony. Or could you please confirm if you are Mr. Anthony? Then we can say, I think that you have already finished your consultation with the doctor. Is that true? They will confirm the same. So after confirming the identity of your patient and the purpose of the visit, we can then tell them about your objective or what you're trying to achieve during this role play. So we can start off by telling the patient about your objective. So we can inform the patient about your objective by saying that I have been assigned by your doctor to talk to you regarding your condition and to provide details regarding the diagnostic test, which will give us a better understanding of your condition. So after informing the patient about your objective, you can then discuss with him regarding the suspected condition and about its possible causes and risk factors. So we can start off by asking whether the doctor has informed the patient about his diagnosis. Okay, then once the patient tells you he has no idea, we can just give them a brief understanding about what the condition is and what are the possible causes and risk factors. So after informing the patient about your objective, so we can tell the patient, after the clinical examination, the doctor suspects that you have a condition called athlete's foot. So then you can provide the patient with a brief information regarding his diagnosis and what are the possible causes and risk factors. So we can say, Mr. Anthony, the doctor has conducted a clinical examination and suspects that your condition is athlete's foot. Please don't be worried. This is a commonly occurring fungal infection. And there could be quite a few risk factors and causes for this condition. So as part of the causes, we can talk to the patient about what might have triggered this condition. So we can inform the patient that this is a type of fungal infection caused by the tinea fungus. And this condition is usually caused due to direct contact to an infected person or an infected surface. So then further we can elaborate on the possible risk factors for the further spreading of this condition. So the possible risk factors or causes that could trigger this condition further include sharing your personal belongings with others, or by contact with an infected surface, or by walking barefoot in public areas. So if required, you can take this opportunity to ask the patient whether he has the habit of sharing his personal belongings with others, or if he has the habit of walking barefoot in public areas, and then we can advise him to not do the same. Okay, so we can ask the patient to stop sharing his personal belongings with others as soon as possible, because or else it could lead to further spreading or contamination of other surfaces or spreading of this condition to other people. So it is very important to stop his habit of sharing things with others. So once you've talked to the patient regarding the possible causes of his condition and about the risk factors of the same, we can then inform the patient about the diagnostic test which has been suggested by the doctor. So here we can see in the role play card that he has been asked to undergo a procedure called the KOH test. The KOH test is a very simple diagnostic test which is also commonly referred to as the potassium hydroxide test. During this procedure, we will be collecting some samples from the infected area of the patient, that is the foot in the scenario. So we can inform the patient that during the procedure, we will be collecting some samples from the infected area, which is the foot in the specific scenario. And after collecting the samples, we'll place it on a slide and immerse it in a solution of the KOH. During the procedure, this solution will kill off the presence of the normal skin cells and will help us to visualize the presence of any fungal growth when placed under a microscope. Then by looking through these slides properly, the doctor will be able to provide a definitive diagnosis of the patient's present situation. So after talking about the diagnostic test, you can just ask the patient whether he has any concerns, and he might ask you whether you have any idea regarding the possible treatment options. Keep in mind that the interlocutor might not always ask you about the treatment options, but it is always safe to just ask them whether they have any concerns. So it is always important to give your interlocutor an opportunity to ask you about his or her concerns or any queries, so we can do the same. So if the patient does not have any concerns, we can just inform them there are some possible treatment options available for your condition. So we can see in our role play card that some medications have already been specified, but always remember that it is not necessary to inform the patient about the medications by their name. Okay, so then we can reassure the patient that many treatment options are available for this condition, primarily in the form of any oral medication or in the form of any topical creams. And if you feel comfortable to do so, you can always inform the patient about the medications that have been specified in the role play card. So we can ask the patient about his consent, whether he's willing to undergo the test or not. So if the patient were to show any hesitation or any reluctance, we can just reassure him about the importance of undergoing the test as soon as possible. Because the sooner that we are able to diagnose his condition, we'll be able to start with the treatment at the earliest. So after talking about this and convincing the patient about the importance of the test, we can just ask him, do you have any further questions regarding your condition or the skin test? So once we've ensured that the patient has no further queries, you can just tell him, okay, thank you for your patience. And if you have any other concerns, you can contact me. And we can tell the patient that you can wait here for a few minutes and we'll call you in as soon as we're ready to collect your samples. Thank you for your patience and I'll see you soon. And that will be the end of your role play card. And if a scenario were to present itself where the patient is not willing to undergo the procedure, we can just ask him to come back on a date according to his convenience. After this, you can just tell him, thank you for your patience. Please come back soon. So I hope you understood the presentation of an intermediate role play, and I truly hope that it could be beneficial in your OET speaking preparations. So do stay tuned for more role plays in our 10 Essential Role Play series. This is Joel signing out. Thank you and have a good day.